I've used the analogy a couple times. I feel like like moms are. Like moms, you throw your arm out in front of your kid when you have to stop suddenly. It's just reflex. You don't even think about it. And, I still do it. And I have adult children. If someone's sitting in the front seat with me, it's going to happen. That arm's flying out to hit you in the face. And that's kind of where I feel like I'm at, in that I know I get like this, and that approach and the way I present myself might not be everyone's cup of tea, but I'm coming from a place of truly caring about people, and wanting you to be aware of risk and how to mitigate your risk and reverse if there's evidence in the blood work that you're starting down a path that you don't want to go down. And so that's what these videos are about, teaching you, helping you to advocate. If you're in Timbuktu and there's no way you could ever come and be my patient, then I want you to go into your next health encounter like guns blazing. Like, what do I got to do? Like, I want to live till I'm 200 or Jesus comes back. Let's get at this. And I don't know of a healthcare professional on the planet that wouldn't be like, oh, okay, cool. And like would try to change the way they're interacting with you, because they hear that you're not just like, give me my Z-Pack. And I'm going out the door and I don't want to hear any of your discussion. Hey everyone, I'm Lucy Douglas. I'm a family nurse practitioner, and I'm owner and CEO of New Beginnings Wellness Center and Spa here in Reston, Louisiana. I'm talking today about a subject that I get pretty excited about. It's diabetes, and it's November, so it's Diabetes Awareness Month. So I'm just speaking about these important subjects, certainly in honor and in respect to those people who are living with diabetes, either type 2 or type 1. And I know that it's a journey. And then also always I'm coming from a place of these diseases, obviously with the exception of type 1, that is an autoimmune condition, but type 2 diabetes can be prevented. And I just don't feel like my colleagues and the industry at large out there is really bringing that message as strongly as it should be brought to you. It should be being blared from rooftops. Every commercial should be saying, you don't have to die of chronic disease. Let's eat fruits and vegetables. Let's not eat at McDonald's. Where are all the fat, sick, dead people coming from that are walking around out there? It's not a mystery. And some of the points and the pearls that I'm hoping people would take away from these talks is that these chronic disease can be identified in the body often many years before it becomes a problem or manifests as a disease. And if it is identified, if we see problems on lab work that would tell us, we are insulin resistant or we have become type 2 diabetic, that we can put a plan in place to reverse that, and that you get off that train and you get on the train to health. And I've used that analogy for many years because I think it's a great visual, because literally you have a choice. And that's another really big take-home point for me, is that you are aware that you have a choice. If you're 50 years old, you have a choice what the next 50 years look like for you. I have a 3-year-old granddaughter. She tells me, get down on the floor with me, Lulu. And, so I need to be able to get down on the floor with my 3-year-old granddaughter. I jokingly told my son-in-law not very long ago, I said, I'm taking her to the Great Wall of China. And he was like, what? I said, yeah, when she's old enough to care and to be a travel buddy, we're going places. So I want to be in tip-top condition so that I can live out my days, however many number there are, and be in optimal health and not be decrepit and old and tired, and other people are needed to take care of me. I just don't think, and I know there are things that happen every day that are outside the realm of our control. So I'm not speaking about those things. I'm speaking specifically about chronic disease and its horrific incidents in our country and the toll that it is taking on people, the financial toll, but the human toll. And I'm saying it again, I'm repeating myself. These things can be prevented. So I've talked about insulin resistance being a precursor to prediabetes and diabetes. Sometimes insulin resistance precedes prediabetes. Sometimes they present if the person is brand new to me. Sometimes that is all revealed together in the blood work. So those are just some things I really want you to grasp and begin to ponder. And if you're not, if you're the drive-through queen and that's, how you live your life and, you take advantage of those convenience type foods, I know most people just don't make, a 180 degree turn overnight. But I'm hoping I'm giving you something to think about and that you don't go away from these talks the same as you came. I'm really hoping that something I say stirs you, or that my passion kind of, makes you sit up and go, well, I don't really typically see healthcare professionals, in traditional settings getting, upset at me because I eat Chick-fil-A 5 days a week. I am upset at you for doing that. Again, where are all those dead people coming from? Is it too much cauliflower? I would say no. So type 2 diabetes is a very complex disease process involving numerous organ systems, and it is a progressive disease. So if you are a diabetic, if you are a family member of a diabetic and you've noticed the stepping up of, well, I was on another medicine that's 2 medicines in 1 pill, or now I'm on an injection. That's indicating the progressive nature of type 2 diabetes. It's because one medicine without any corresponding lifestyle changes is not going to keep you out of the funeral home. It's going to keep getting worse, keep getting worse, keep getting worse, and more medicines having to be added in until you reach the point of requiring daily insulin. And there's a lot from an anatomy and physiology perspective that I could get into to sort of explain why some of that is, but I probably would bore you slap to tears, and I don't want to do that. But just understand that there are about 8 metabolic defects that are in play at any given time with the diagnosis of type 2 diabetes. So where you might be newly diagnosed with a hemoglobin A1C, say, of 7, when I said that we diagnosed type 2 diabetes with a hemoglobin A1C of 6.5% or greater, and they put you on metformin, well, maybe at that moment, you only have 2 of the 8 of the metabolic defects. You have a problem with the liver lacking insulin sensitivity, and you have a problem with the skeletal muscle lacking insulin sensitivity. So metformin, we know metformin improves insulin sensitivity. It also calms the liver down and stops it from inappropriately secreting stored glucose into the bloodstream at wrong times. So that's why metformin is a good drug, because it covers a couple of the different metabolic defects. But if you don't do anything else and you keep living your life in the drive-through lane or eating the hot water cornbread and the smothered steak and the Coke and the Little Debbie's, then it's just a matter of time before the defects stack one on the other until you're requiring more and more medication. You've got more and more metabolic damage. And then, as I mentioned in the previous video, chronic high blood sugar damages the delicate lining of your blood vessels. High blood sugar contains toxins, chemical toxins, and those behave like shards of glass inside the bloodstream, creating pits and tears in the endothelial lining, which allows and makes you more prone to certain cholesterol particles penetrating that endothelium and creating plaque down in the lining of your blood vessel. So that's why diabetes is a cardiovascular disease. When you are diabetic, your risk for a heart attack or stroke is 3 to 4 times that of the non-diabetic. So I found, especially when I was teaching nursing and taking students to the hospital every week and taking care of patients that were suffering the complications of long-term, poorly treated diabetes, I found that there was sort of they're diabetic, so let's just set our watch because the complications coming. And so the surgery for the amputation didn't seem to upset anyone. And this was just me observing this over months and years, just setting me on fire. I'm like, why are we not mad that we're taking these people to surgery and cutting off their toes and then cutting off the front portion of the foot? And well, oh, now we've got to do a below the knee amputation. And oh, now we've got to do an above the knee amputation. It's madness. It's utter madness. And I cannot believe that in this day and time, that is still happening. And so you need to know that you should be in a relationship with a healthcare professional who is interested in your long-term well-being, who hasn't drank the Kool-Aid, that there's nothing that can be done about any of this, and that once you're a diabetic, you're always a diabetic. I'm going to tell you right now, that's a lie out of the pit of hell. And when someone comes in here and they say to me, well, my so-and-so told me I'll be on this medicine forever. Well, I don't have a crystal ball and I have no way of predicting with 100% certainty what we can accomplish together. But I say to them, how badly do you want to be off of it? Because the work is going to be on the patient. I can inform, I can educate, I can speak into your life, I can recommend the supplements, I can recommend the nutrition, but you are the one that has to go home and walk it out. You are the one that has to go home and implement the plan. You know, I was not diabetic at the time of my epiphany in 2009. I thankfully was not yet pre-diabetic. I believe I was insulin resistant. And when I had that click in everything in my being, that I was headed in a direction I didn't want to go and I was changing that day, I didn't ask anybody in my house what they thought. Now, everyone's dynamic in the family is different. The youngest person in my household was 16 at the time. So I didn't have toddlers hanging on my leg. And I didn't have the kind of husband that had a real particular expectation about what was served to him. So it was quite easy for me to just be like, well, this is my problem and I'm the one who shops and cooks. So I'm just going to start doing it differently. And I feel like I've even laughingly told patients, look, take me home with you. I'll sit down at your dinner table tonight and we'll all have a conversation together. Because, you know, I take care of both men and women, but I am speaking a lot to women. And I find, and husbands, if you're listening to this, I find that women struggle to implement lasting change because they're afraid that you won't support them. They are afraid that they're not going to have the cheerleading and the complete latitude to just change as a whole what the family is doing. And so that I can't meddle in people's marriages and relationships, but I'm just being very transparent with you that I talk to people all day, every day, and have for the last almost 8 years. And these are common themes. So diabetes is a serious illness. Generally, it doesn't hang out by itself. Very often we see lipid, cholesterol abnormalities. We see lots of inflammation in the blood through blood work, and we see a lot of times high blood pressure. And I call that the unholy trinity. those are the people that are having the heart attacks and strokes. Those are the people that are experiencing the loss of good circulation, are having the numbness and the tingling. They're having the cold hands and feet because they don't have good blood flow, because high blood sugar damages the blood vessel. The toxins almost also damage the nerves. And so they're losing balance and they're having pain. And it's just this awful cascade of complications that has a dramatic negative impact on quality of life and length of life. I think we've become very accepting of people dying in their 70s, and we all go to funerals and cry and act like it's perfectly fine. Well, Bob had a heart attack. I didn't even know Bob was sick. Well, Bob might not have darkened the doorstep of a doctor in 20 years, so there's that to contend with. But there's also the lack of quality, unfortunately, in this medical model that we exist in, where it's very symptom-driven. There's not the using of the 21st century technology like I'm currently using to assess someone's internal environment, to give you an excellent, real-time, up-to-the-minute snapshot of what's going on. Do I have jacked up, inflamed, plaque-filled vessels? We can actually know that with very good, what is the word I'm looking for? Very good accuracy. So it's not like you have to be just a lamb being led to slaughter. I kind of went over a lot of the details of the anomalies leading to blood sugar abnormalities in my previous 2 videos. So I apologize, I'm not probably giving you very much meat about type 2 diabetes, but I feel like there's a lot of knowledge out there, or at least a general knowledge, because it's such a common disease. And so probably most of us know someone who's on a medicine for their blood sugar, and you see that their lifestyle is basically the same as it was before their diagnosis. They've not changed anything. And that to me is appalling. When I was in my rotations in nurse practitioner school and was in a family medicine setting, I would take the diabetic patients in a room and close the door and just start pouring my heart out, trying to make sure they understood as much as they could possibly understand about what was going on with them, and that there's more that needs to be done than here's your prescription, I'll see you in 3 months. I would just say, how is that working for us? Don't take my word for it. Google the statistics if you think I'm being overly dramatic. So it is necessary that you have regular screening, that you are with a provider that knows to use the hemoglobin A1C to assess your risk for diabetes, and also using that in conjunction with the fasting blood sugar. I mentioned that a fasting blood sugar should be less than 100. I personally have a bit more aggressive of what I consider normal, and I would like that at 85 or even 80. I'm not mad about. The hemoglobin A1C, the prediabetes range is 5.7 to 6.4. We typically diagnose type 2 diabetes once that A1C reaches 6.5 and above. I, for my non-diabetic patients, would like your A1C to be less than 5.4. And I also can do an insulin resistance panel that even goes a little bit deeper and gives us some additional information that correlates with the A1C and the fasting glucose. There's other tests that should be done to complement that. Certainly an in-depth lipid analysis, looking at your cholesterol, not just that 5-number panel you're used to. There's a lot more that has come to our knowledge through research because cardiovascular disease is so deadly. And so there are other wonderful tests we can use that are even more specific and give us awesome information about if you've been told, oh my gosh, you have high cholesterol or the bad cholesterol is elevated. Well, guess what? The LDL, or what we have called the bad cholesterol, really, it's kind of an unfair descriptor, because there's more information that can be learned about the LDL. And so I actually can know how many particles you're making, and what is their breakdown, small, medium, and large, and then some other unique particles that give us more information about your risk for forming plaques. So this is all awesome information. You should be having these kind of tests early on so that you can establish a baseline and then know, do I have some little things getting out of whack? What do I need to do to fix that? And then when should we look at that again to see how I'm doing? So I need you to have a more proactive, like how you take care of your car. I've used that analogy before in an earlier video where I feel sometimes we are more on top of our car maintenance than we are our health maintenance. And that, that we should be like doing this as a family. That mom should not just be the only one, trying to get her fruits and vegetables in. And then, everybody else wants tacos and pizza. Like it should be as important as a family unit as, if you pursue your faith as a family and church attendance and, family, you have a tradition of a family of holidays together and, all of those wonderful things that we do as families. I'm encouraging you to bring this discussion in and like, what are our family values around our health? What are our family values around our nutrition? That doesn't mean you're never going to eat Johnny's Pizza again. So calm down. It means that you understand that a regular, constant diet of highly processed fast food is not good for us. It's not good for any of us. It's not good for our children. And it is what is leading us to all of the diagnoses of diabetes that we see. It's just so inordinately common. And I don't find that anyone is particularly upset about it. So I'm wanting you to appreciate and understand that it is a complex, multi-system disease. It is progressive, left to its own devices. But I say, in the face of that knowledge, that you still can turn that boat around. We can still make a positive impact in your numbers, in decreasing inflammation and helping you attain a healthy weight. And I just get excited when people come back in and say, I just feel so much better. And sometimes it truly is that simple, that changing the diet, changing to a more whole food. And I keep using that, but whole food, I only mean what I say, whole foods. You're shopping on the outer perimeter of the grocery store. You're very much limiting your exposure to things in packages, bags, cans, cartons. Those things are made in factories, and we don't want to expose ourselves to lots of that on a regular basis. So whole foods, fruits, vegetables, complex carbohydrates, those are actually not off limits for the diabetic. So the research is quite sound and extensive that complex carbohydrates with lower saturated fat intake actually improve insulin sensitivity. I know, clutch your pearls. I'm a heretic. Go look it up for yourself. Google insulin resistance and saturated fat if you think I'm a cuckoo bird. The research is decades old and it is sound. And there's actually, if you are a diabetic or have a loved one who's a diabetic, let me just throw out this resource for you. There's a fabulous website called masteringdiabetes.com. The guys who run it are diabetics. They're amazing. They're throwing out wonderful knowledge and teaching people how to heal themselves of insulin resistance and diabetes. So don't take my word for it. Go look it up, study it for yourself, and see if it resonates with you. The other thing I touched on in the previous video was the benefit of intermittent fasting. This can be a very useful tool in healing the body of insulin resistance and diabetes. And there's an awesome resource. His name is Dr. Jason Fung. He's a Canadian kidney specialist. And he's become the man when it comes to discussing fasting and how to implement in a healthy way a fasting regimen into your life. The science is phenomenal to support its usefulness for healing of chronic disease, but I'm onto it for its benefits in anti-aging and longevity. So it just stands to reason. If we stop putting food in our mouth for a specified period of time, we actually can then divert the body's energy and effort away from constantly having to focus on digestion to working on cellular repair. So it's quite fascinating. And I find that the large majority of my patients can pretty easily begin a fasting regimen into their life to where they can do it and do it safely and in a healthy way. So diabetes is not forever if you don't want it to be. It is not a death sentence if you don't want it to be. Hear me. You have control. Get more comfortable with advocating for yourself. And so that you go into a conversation with a healthcare professional armed and ready and expecting a dialogue, because that's what I always am trying to do, is promote conversation, because every single person that comes and sits on this couch, they bring their own story and their own perspective. And I need to hear that as we work together to put together a plan to help you heal and be all that you are supposed to be. So talked more today than I kind of expected to, but if you've hung out with me this long, thank you so much. I always want to know your questions, any feedback you might have. If this is helpful, give me an emoji. If you have suggestions for other topics you'd like me to tackle. My daughter just was like, "You're going to talk about what today?" She was like horrified. She said, "How boring." So here I am. I did it anyway, but if you want to hear something else and anything else that you're interested in, I want to know. So thank you, and I look forward to talking to you again soon.